So the title of the talk today is Menopause Symptoms and Cystic Fibrosis, Preliminary Findings from the CF Menopause Interview Study. And here my team is listed, myself, my two co-Is, Pauline Mackey, who is a very well-known menopause researcher on neurocognition. I highly recommend all of her work. She's a mentor of mine. And Sarah Parker Harris, who is a sociologist and disability rights researcher. And then Cynthia Folk, who is my research assistant. Okay. So essentially, the blessings of improved therapeutics for people with CF have opened up a research issue or a research question. That is, how is peri-menopause and post-menopause impacting females with CF? With the median age of CF now at 65, there has been also a rising number of midlife women with CF, and we think it's about 1,900 people. So even though there's a growing number of us in midlife, there haven't been that many studies. There's only 2 completed survey studies that have looked specifically at menopause and CF. And the reason why there's only 2 is that we haven't lived this long. So now I think the issue is on the table and people are starting to pay attention. So the first study is by Perchownik and her team, Dr. Jane, Dr. Taylor Kusar, Dr. Kazmersky, and others. And this was a survey study of 460 women, 39 of whom were in perimenopause and postmenopause. There are a couple of limitations to this study. It only captured 5 women in the perimenopausal state, and then it captured 34 in the postmenopause stage. So there's a pretty limited number in the menopause transition or perimenopausal state. The other limitation is that this was a survey conducted before Trikafta. And the third limitation is that women self-reported their menopause stage. So the stage that they divided the women up into different stages, and I'll tell you what they found. That's based on self-reporting. That's not verified by hormone testing. So this study still provides very important information for menopausal experiences in the CF community. So what did they find? They found that the median, meaning the middle age of menopause, which is 12 months after your final menstrual period. So when somebody says menopause, it's literally one day, and it is exactly 12 months after your final menstrual period. You won't know it until you haven't had a period in 12 months. So you're not going to know when you're sort of chugging along and skipping periods when your last one is going to be, and then 12 months after that. So it's kind of a retrospective thing. Anyway, they found that the median age of menopause in CF is 48.5 years of age, plus or minus 5.5 years of age. And then they found that the average age of healthy women to reach menopause is 51. They didn't find this, sorry. The average age of healthy women is 51 years of age. So there's a slight difference. It's not huge, but there's a slight difference. They also found that the average age of menopausal onset, and this is the point that you have your final menstrual period, for women with CF is 46.5 years of age. And for healthy women, it's 49.3. So again, it's slightly earlier. These researchers also found that 30% of their respondents had worsened CF symptoms during perimenopause, and 42% of their respondents experienced worsened CF symptoms during their postmenopause stage. And the main symptoms they reported, these respondents, was sleep disturbances, joint problems, and night sweats. Some of you may know what they're talking about. 24% of perimenopausal women, that is the five women, were on estrogen therapy, and 15% were on what's called combined menopause hormone therapy. 1% reported talking to their CF provider about menopause, even though 19% felt that they wanted to have that conversation. And these statistics show that women with CF, just like healthy females, have low rates of patient-provider communication about menopause. Now, there's since then been a study that was conducted last May of 2025 by Melissa Putman, Heidi Guzman, Leslie Ann Story, and a team, including myself and Rebecca Muller. I don't know if she's in the audience here. And we conducted a survey on menopause last year, and in 1 month, 118 people responded. Now, in this study, they included women 35 and older. And their sample was made up of two major age groups. 71% were in the age group of 35 to 54, and 29% were ages 55 and above. Now, the 35, so some of the people, and I'll report this in a second, but some of the people were in what's called pre-menopause. So they included people who had not started perimenopause yet, that were still getting regular periods, like they were 20, but they were 35. Okay, so 19% of this sample were in premenopause. Again, that's before you start perimenopause. 35% were in the perimenopause stage, and 36% were in the post-menopause stage. And then another 10% were unsure of their menopause stage. The majority of participants, that is 60%, reported mild to moderate symptoms. 38% were asymptomatic, and 2% experienced severe or extremely severe symptoms. The most common symptoms, again, similar to progesterone, is sleep disturbances. And then this study found fatigue and irritability as the next two common symptoms between the two stages. Sorry. Most participants discussed menopause with their healthcare providers, primarily with a gynecologist, but many expressed that they wanted to have further discussions. So these findings from these two studies suggest a critical need for further research on menopause and CF. And this critical need is based on the fact that this milestone may impact females with CF's health more than the general population. It may not, but it may. It also may increase risks for already emerging aging issues in CF, like cardiovascular disease, joint pain, sleep apnea, cognitive dysfunction, and bone disease. And further research can inform targeted clinical interventions to help optimize our health and well-being. So this is where my study comes in. This study is a follow-up study to the Guzman-Putman menopause survey that was conducted last year. And the aim is to describe how adult females with CF experience peri and postmenopause in a diverse sample of females with CF via surveys and interviews. So the newest thing to this study is that I'm conducting interviews. So I'm just going to review some of the, study criteria and the methods. So I had a target of 40 people for this study, but there was a huge response. We had 129 respondents in 1 month. So I allowed 67 people to enroll. because I I really thought, hey, this is a chance to get everybody's voices. Now, in the process, 14 people of the 67 have been withdrawn, six due to data inconsistencies, and eight due to the fact that they didn't proceed with or finish the surveys after enrollment. So right now we have 53 people who have completed the survey data and either scheduled or completed an interview. And as of yesterday, or a couple days ago, I've conducted 21 interviews and I have 32 pending. So I still have a lot more work to do. Now, in terms of recruitment, the first thing we did was that we recruited from Community Voice. Now, and this is why it's the follow-up study to Guzman and Putman. Um, when that survey was conducted last May, women were able to say that they wanted to participate in an interview. So 38 people said they wanted to. And so we started with those 38 in recruitment, and 18 ended up enrolling and finishing their surveys. And then we did a second round of recruitment after we got the 18. And we did this through social media recruitment on relevant private Facebook groups. So some of you may have seen this if you're participating on CFRESH, on Mothers with CF, and on the peri and post-menopause females with CF Facebook group. Yeah. So, okay. Then once we had these eligible women who, wanted to enroll, I wanted to make sure that, well, I wanted to try to get an even number of peri and postmenopausal women. I didn't want to have like that 5 and 34. I wanted to have more even numbers at least. It's kind of hard to know, but so I, tried to do that when I selected the people to invite. And I also invited people on race and ethnicity so that I could get a more diverse sample, and also on modulator status. I wanted to get people who were not on modulators as well. So, my inclusion criteria include, and this is like who's eligible, um, included females who were between the ages of 40 and 65. So I was not interested in recruiting premenopausal women. Females with CF who can read, write, and speak fluent English. Those who reside in the US. We did have some people outside of the US who really wanted to participate, but I had to limit it to just the US for now. Those who self-identify as peri or postmenopausal. Oh, there's Maggie. Outside the US. Those who were on a stable CFTR modulator for the last 3 months. And then those who would, said that they would complete the questionnaires and participate in an interview, and they had to have internet. But the exclusion criteria, those people who were not eligible, were those women who were receiving treatments or chemotherapy, who were pregnant, who had the surgical removal of their uterus or ovaries, and who were receiving gender affirming care. And out of the 129 total respondents who took the screening questionnaire, 41 were excluded. That's 32%. And it was primarily due to surgical menopause. Okay. So the participants in this study took surveys and also are now participating in interviews. We offered a baseline questionnaire that measured demographics or asked about demographics, health behaviors, health histories, menopause status, pregnancy history, and then a whole range of medical tests, and then hormone therapy knowledge and use. We also administered 2 menopause tools, the menopause rating scale and the MenQual. I should say that the Putman-Guzman study also used the menopause rating scale. And then the final thing that we included was the CFQR. And the CFQR is the CF Quality of Life Revised Instrument. So we get this every 3 months in the clinic visits. So I'm sure all of you are aware of CFQR. Okay, so once women completed those surveys, they could schedule their interview. And the interview is a Zoom interview, 90 minutes long. And I have literally spent the entire 90 minutes. Nobody has been, 60 minutes or anything. If anything, the interviews have gone over because people have a lot to say, which is just great. So in that interview, I asked about these following domains: aging, menopause symptoms, overlapping CF symptoms with menopause, the knowledge and use of hormone therapy, self-management strategies, conversations with providers. And then I also ask about how people felt, while they were participating in the study, if they had any issues, do they have any improvements they want to suggest, and then areas for future research. So here are the preliminary results and an exasperated woman. Get ready for a lot of percentages. So the study has 33 females in the perimenopause stage and 20 females in the postmenopause stage. Most of the perimenopausal females are in the 40 to 43 age range or the 44 to 47 age range. And most of the postmenopausal females are in either between 52 and 55 or 60 and 63. 75% of the perimenopausal participants in this study are non-Hispanic whites, and all of the postmenopause participants are non-Hispanic white. 9% of the perimenopausal participants are Hispanic or Latino, and 6% are Black African American. 81% of the perimenopausal participants are on modulators, and 65% of the postmenopausal women are on modulators. So in terms of self-reported disease severity, we asked women how they would self-report their disease severity. A majority of the perimenopausal participants reported that they had moderate disease, and 75% of the postmenopausal females said they had moderate disease. About a third of the sample are participants with late diagnosis, which has been extremely interesting in my interviews with them. We also asked about menopause hormone therapy knowledge and use. 48.5% of the perimenopausal participants said they had never used hormone therapy, while 55% of the postmenopausal women said they had never used hormone therapy. Yet about 30% of the peri and postmenopausal females are currently on hormone therapy. And this is really a positive sign because only about 5% of American women are on hormone therapy. So this is the menopause rating scale that we used. And this is a common scale used in menopause research. It's one of 3 instruments used in this study. And this scale measures the current severity of menopause symptoms. You can see which of the following symptoms apply to you at this time. So it's not like in the past month, it's, nothing like that. So though the menopause rating scale does not capture the frequency of symptoms, meaning like how many times was this reported by participants, how many times a symptom was reported by participants, we wanted to get a sense of the top 5 symptoms reported per menopause stage. So what we did was we totaled the percentages of mild, moderate, severe, and very severe. And so as you can see from the top left, the top 5 symptoms for perimenopausal women are sleep, anxiety, brain fog, irritability, and vasomotor symptoms, hot flashes, sweating, night sweats. That's what vasomotor symptoms are. And this is not unlike, right, the Guzman and Putman findings of sleep, irritability. I'm not sure, I don't remember if they looked at anxiety or reported anxiety. For postmenopausal women with CF, in this order, the top frequently reported symptoms are sleep, vasomotor symptoms, brain fog, sexual problems, joint and muscle pain. So sleep is the most reported symptom between both of the groups of females. And then there's other common symptoms like brain fog and vasomotor symptoms. But there's also differences, as you can see, in these profiles between peri and post, including a high frequency of anxiety and irritability for perimenopausal females, and sexual problems and joint discomfort for postmenopausal females. So in this study, we also used a quality of life instrument called the MenQual, the Menopause Quality of Life. And that captures the menopause symptom frequency, so how many times it's reported, and then the level of bother. So it's not about severity, it's about how much it bothers people in the past month. And some of the symptoms in the MenQual are different than those captured in the menopause rating scale. So they're slightly different, or they're worded differently. So the 5 most reported menopause symptoms in the MenQual, as you can see on the bottom left, are for perimenopausal women. This is about bother, irritability, sleep, fatigue, anxiety, and poor memory and night sweats. So instead of like a general vasomotor symptom category, as you see above in the menopause rating scale, in the menopause quality of life scale, there's like 2 different things. There's night sweats and there's hot flashes. So night sweats are reported here in particular as particularly bothersome. And then for postmenopausal women, dry skin, night sweats, sleep, low libido, and vaginal dryness show up as the top 5 symptoms. So again, sleep is really, really important here. It shows up in all the groups. It shows up in Prochownik. It shows up in Putman. It's a really significant issue for women with CF. Otherwise, we see that in the MenQual, at least, perimenopausal females with CF report more cognitive and mental health symptoms, while postmenopausal females report sexual and vaginal symptoms. Okay, so the following slides discuss the results just from the menopause rating scale. And we're still scoring the MenQual on a level of bother and the CFQR. Again, I said this was preliminary, so we're in the middle of it. In the menopause rating scale, we see that among perimenopausal females with CF, sleep, brain fog, irritability, sexual problems, and anxiety, vaginal dryness, and vasomotor symptoms have the highest average severity. So not how many times it's reported, but how severe it is. So those symptoms are the highest in terms of severity, average severity. Most of the symptoms align closely with the frequency slide I just showed you, but sexual problems and vaginal dryness are included as well here when we focus on severity. Amongst postmenopausal females with CF, sexual problems, vaginal dryness, sleep problems, vasomotor symptoms, and brain fog have the highest average severity. Again, this severity profile closely aligns with the frequency data, but the top 5 symptoms in average severity for postmenopausal participants does not include joint pain like it does when we just talk about the most frequently reported. Okay, now, if we compare the average severity between the two stages, peri and postmenopause, in the slide, we see that there are many common symptoms between menopause stages in CF. But these results also suggest that the symptoms' average severity shifts from one stage to another. Importantly, perimenopausal females experience more severe mental health symptoms than their postmenopausal counterparts. So if we broaden our view in this scale is made up of three what they call dimensions. So they kind of group some symptoms together in each dimension. The psychological dimension includes depression, irritability, anxiety, and exhaustion. The somatic, the physical, include hot flashes, heart discomfort, sleep problems, and joint or muscular discomfort. And then the urogenital includes sexual problems, bladder problems, and vaginal dryness. So when we look at the average severity of each dimension instead of each symptom and compare the score to healthy women, we can see that females with CF exhibit a higher average severity of each of these three domains. That's really important compared to healthy women. Furthermore, we can see that perimenopausal females with CF have a higher average severity in the psychological and somatic dimensions than postmenopausal females with CF. Yet postmenopausal females with CF have a higher average severity in the urogenital dimension than perimenopausal females with CF. And this shift to more severe urogenital symptoms amongst postmenopausal females with CF is actually not surprising because there's something called the genitourinary syndrome of menopause, GSM. If you go to your gynecologist and you have some of these symptoms, you can say, I think I have GSM. That's what it's called. And that is known to be more common in postmenopausal females in the general population compared to perimenopausal females. So while urogenital symptoms can start during perimenopause due to falling estrogen, they often become more severe in the postmenopausal stage as vaginal tissues get thinner and drier. So I want to call your attention to the bottom where it says total 14.59 and then 9.2. In CF, the total average severity of all these dimensions, meaning the severity of how bad it is a score of 14.59. But in the normative population, it's 9.2. And a total score of 14.59, if you look at that scale, like on the far lower right, between 9 and 15 is considered moderate severity. So you can see that women with CF experience the upper range of that moderate severity as compared to healthy women who are still in moderate, but they're on the lower range, like it's the extremes. And so this suggests, and again, this is just one study and it's just one scale, but this suggests preliminarily that females with CF may experience a different level of severity of symptoms in the general population. My colleagues and I are still looking into whether or not this difference is statistically significant. So unfortunately, I can't telescope every single symptom, so I thought I would just focus a bit more on the cognitive and mental health symptoms, including if they differ by modulator status. Okay, so this again is from the MRS. Perimenopausal females with CF in the MRS and the MenQoL cite anxiety and irritability as top symptoms. In the MRS, we found that perimenopausal females with CF on and off modulators reported moderate severity of anxiety at a rate of 39%, and those same participants reported moderate irritability at a rate of 36%. And these percentages are maybe attributed to the erratic hormonal, likely attributed to the erratic hormonal fluctuations in perimenopause, but they also could be related to the stressors of experiencing perimenopause alongside a chronic illness like CF, side effects of CFTR modulators, or both hormones and modulators. It's as we'll see, quite difficult to know. That 10% of postmenopausal females with CF report moderate severity for anxiety and 20% for irritability suggests what we call a stage effect. What do I mean by that? So just if you take anxiety, 39% of perimenopausal females with CF have a moderate severity of anxiety, but only 10% of postmenopausal women with CF have that. And then the comparison is between 36 and 20 for irritability. So what this means is that as you travel from peri to postmenopause, your anxiety and irritability decrease, right? I mean, that's what this suggests. And that's what we call a stage effect. When everything else is kind of stable, including modulator use. And then all we see in terms of the change is about stage, and we see that symptom severity changes. Now, let's look a little bit more at detailed information that compares stage and modulator use. So here are two tables that show anxiety and irritability by menopause stage and modulator use. If we look at anxiety by menopause stage and modulator use, we see that of the perimenopause, this is the table on the left, of the perimenopausal females on modulators, 30% reported moderate anxiety and 40% reported mild anxiety. But for postmenopausal females on modulators, again, modulator being stable here, the only thing that's different is the stage. Only 5% of postmenopausal females on modulators reported moderate anxiety, and 25% reported mild anxiety. Again, we see a reduction here, and that suggests a stage effect. If we compare perimenopausal users and non-users of modulators, okay, so here we're changing modulators and non-modulator use and keeping the stage stable. So if we compare perimenopausal users of modulators and non-users for anxiety, we see that 30% of perimenopausal users reported moderate severity compared to 9% of non-users within the same stage. And this result points to a modulator effect, which for many of this audience is probably not that surprising, given that modulators are known to create a lot of anxiety. And then we see a similar pattern in the post-menopause group as well. And these numbers are small. However, so we need to investigate this to tease all this out. Now for irritability, if we look at irritability by menopause stage and modulator use, we see that 36% of modulator users in perimenopause report moderate symptoms compared to 15% in the post-menopause group. So like anxiety, the frequency of moderate irritability between peri and post-menopause is reduced, which again points to a possible stage effect. So when we look at brain fog, a total of 36.36% of perimenopausal females with CF that are both, whether they're on or off modulators, also described experiencing moderate brain fog, which, as my interviewees have explained, noticeably affects their daily life. By contrast, a total of 15% of postmenopausal females reported moderate brain fog, again, suggesting a stage effect. When we compare peri and postmenopausal modulator users, we see that fewer postmenopausal females on modulators reported moderate symptoms of brain fog, and that's compared to their perimenopausal peers. Again, this points to a stage effect. Now, when we compare modulator use and non-modulator use, we see that a higher percent of modulator users within the same menopause stage report mild to moderate brain fog compared to non-users. Again, this could be because of the side effects of modulators. Probably. It's a suggestion. Okay. So in addition to the survey data, like I said, the sort of unique thing about this study is that I'm gathering interview data to learn about the experiences of menopause amongst females with CF in their own words. That to me is super important. And what I'm finding amongst interviewees is that modulators' side effects and menopause symptoms contribute to what I'm calling real attribution challenges. Meaning, like, what does that mean? Attribution challenges. Females don't know, basically, if their symptoms are from modulator use, like a side effect of modulators, if they're from menopause, or if they're just from CF in general. Among the 21 interviews I've conducted, women have overwhelmingly mentioned that they have been trying to figure out what is causing their symptoms during midlife. They've asked their physicians, both gynecologists and CF doctors, and no one can tease this issue out. They've also independently tried to figure out when their symptoms got worse, when they started having symptoms, and to see if it tracks when they started perimenopause, for instance, or when they reached menopause. As one interviewee stated, quote, I started modulators in the beginning of 2020, and then I turned 40 in 2024. So it's also just been hard to differentiate what experiences have been perimenopause and what has been modulators. It just all feels like this big blob of new experiences with my body. These attribution challenges are creating issues for which type of treatments to pursue. So if they don't know if it's CF or the modulator side effect or menopause, do they go on hormone therapy? Do they do more treatments? What do they do? Right? So we don't know what they should be doing. And that's also a cycle that seems to be going on. I should mention that this is not something that's unique to CF. In my research on rare diseases and menopause, I have found that other diseases like sickle cell and Ehlers-Danlos have also reported similar attribution challenges. So the overlapping symptoms between CF and menopause, according to the people I've interviewed so far, are fatigue and sleep, headaches, joint pain, weight gain, and night sweats. So these are the things that are kind of, people are wondering what's what. So related to the issue of attribution, a major theme in the interviews is that of provider dismissal. Some gynecologists state that participants are quote unquote too young for perimenopause and are refusing to prescribe menopause hormone therapy. As one participant related, I don't really have a long history with this doctor, but he totally gaslit me. It was horrible. And given how fragile I was with my mood swings at the time, it was really upsetting. He said, you're too young for perimenopause. You just need to find a way to spice up your sex life. You're having headaches because you're dehydrated. I had been telling him I had been waking up in the middle of the night to go to the bathroom. And he said, well, you're drinking too much water before bed. And I responded, you just told me I was dehydrated. So it was infuriating. I mean, when I have my annual in 6 months, I will not be seeing him. I will literally see any other doctor in the practice. Never want to see that guy again. End quote. So CF providers, endocrinologists, and other providers are said to exercise, are the participants are telling me that they are exercising what we call in my business diagnostic overshadowing. Now, what is that? This is a bias in which physicians wrongly attribute a patient's new or existing but more severe symptoms to a pre-existing condition. So for us, it would be CF. Um, so they automatically assume it's CF rather than considering other possibilities like peri-menopause. And this misattribution often leads to delayed or misdiagnoses or gaps in care. So such treatment prompts my interviewees to strongly advocate for having a provider that is knowledgeable or attempts to offer CF and menopause-related support. Similarly, participants relate that having a menopause specialist is really important, whether or not they even know about CF. In general, they express the desire for more providers to have experience and knowledge about the overlap between CF and menopause. My interviews so far have also highlighted the impact of menopause symptoms on participants' quality of life. And this perimenopausal female on modulators stated, for instance, quote, sleep is the most bothersome, and then probably the anxiety. Sleep seems to cascade into so many things. My ability to focus, my memory, my ability to enjoy time with people, with friends and family because I'm tired, my ability to go to the gym, work out, do my breathing treatments. It seems to really impact almost every aspect of my life. And I would say the same for anxiety. They don't compartmentalize. They just touch everything. So participants use self-management strategies to manage their symptoms. The most common being so far seems to be exercise, meditation, and diet. And despite these symptoms and challenges, women are expressing how grateful they are to still experience aging as a person with CF. So to wrap up, perimenopausal and postmenopausal females with CF seem to have similar profiles as symptom profiles as healthy females, meaning like what are the symptoms in perimenopause that you experience at all. However, the average severity of those symptoms seems to be more intense amongst women with CF. The main difference between peri and postmenopausal females with CF seems to be a preponderance of cognitive and mental health issues during perimenopause that shift to more urogenital symptoms during postmenopause. And this stage difference is also reflected in the profiles of healthy females, where between 27 to 84% of postmenopause females who are in the general population have GSM. The prominence of mental health and neurocognitive issues during perimenopause is likely due to very erratic hormonal fluctuations that occur during this time. So it's not just that your estrogen and progesterone are declining, it's that at least for estrogen, it's like up and down and up and down, and it's totally erratic. So that may cause all these nutty symptoms that like they're there one month and then they're gone another, and then they're terrible and then they're okay, and all of that. That's probably because of this erratic estrogen fluctuation. Those fluctuations disappear in postmenopause, leading, as we saw, to a reduction in the severity of mood and cognitive symptoms. This is what I'm thinking among postmenopausal females. So, and then there's a couple of surprising findings I've had so far, and that is that the average total severity in the MRS is noteworthy, that sort of 9 and almost 15 moderate range. And then, healthy females are at 1, the lower end, and CF females are at the higher end. The other really surprising thing to me is that more people in this study are on hormone therapy than I expected. It's way more than the general population. Attribution challenges are really key here, and physician dismissal is common. So what are my next steps? I'm finalizing these interviews, and then we'll be analyzing the data. And then I will be putting that interview data analysis in conjunction with the survey data analysis to come up with a comprehensive understanding of what's going on. I also submitted a pilot and feasibility grant, which I don't know about yet, to study menopause in 2 CF clinics. And there we would be taking hormone markers and giving a bunch of different kinds of validated instruments, and again, conducting interviews. So I want to thank everyone for being patient with me with this PowerPoint thing. And I also want to thank the retreat planning committee, and I want to thank the Patrick Nash Fellowship for propelling this work. Thank you.